my name is Robin. Today what we're going to do is demonstrate how to insert a Foley catheter. We're going to be using a male patient today, and we're going to be using sterile technique. So one of the first things that you need to do is to check your orders to make sure that that is what you're supposed to be doing. And I've got it right here. It says to insert a Foley for urine drainage. You also want to look at the patient's history to make sure that there's no urinary strictures or prostate issues that would cause problems with that insertion. So we do have Michael Thomas here. I've got my order right there. It says here that he does not have any allergies. I'm going to go ahead and go into the room now. Hi Michael, how are you today?
Good, how are you?
Good. My name is Robin, and I'm going to be your nurse today. Can you give me your name and your birth date?
Michael Thomas, 00000000.
Okay, Michael Thomas, 00000000. And that matches with that up here. Michael Thomas, 00000000. No allergies. Is that correct, Michael? Do you have any allergies that you know of?
Nope, not that I know of.
All right, nothing specific to tape or latex or shellfish?
Nope.
Okay, great. The only reason we ask about shellfish is because shellfish contains iodine, and the product that we use to clean you up with a little bit contains iodine. So we just want to make sure that you don't have any problems with that. Provide for safety here. Okay. I have provided for privacy already. The door is shut. Okay, Michael, what we're going to be doing today is inserting the Foley catheter. Have you had one of those before?
No.
All right, all that is it's a small tube that we're going to insert through the penis, and it goes directly up into your bladder so that we can drain all that excess urine out of there. And hopefully you'll be a lot more comfortable after we do that. So there should not be any pain with this. There might be just a little bit of pressure, but if there is any pain at any time, you make sure that you let me know immediately, okay?
Okay.
All right. I am going to go ahead and wash off my table. I've already gathered my supplies. I've got my wash basin, my stabilizer, my flashlight, my gloves. I've got my Foley kit. I've got my hand sanitizer, and I've got my wipes for the table. Now these are just Lysol wipes, so I don't need to wear gloves for these. But make sure that you check with your facility that you are precepting at or working at. Many of them have a solution that's much, much stronger than this, and you are required to wear gloves with that because some of them are considered toxic, okay? I'm just going to put these over here for now. Alright, I'm just going to pull your covers down here, Michael, and get you ready to get you cleaned up a little bit, okay? I'm going to put some clean gloves on. We're going to go ahead and put a chucks in here just so we don't get your bed all wet. All right, if your patient has foreskin, you're going to want to head and fold that back now. And you're going to leave it there until you actually insert the Foley, because if you put it back after you clean them, then it's just going to be dirty all over again. Okay, and then you're just going to simulate with a bowl of warm soap and water. Take a clean part of your washcloth, start at the tip, and go around in a spiral fashion. Get a clean part, do it again. Okay, get a clean part, do it again. And then you would do the same thing with your rinse, and then you can go ahead and pat him dry at that time. Take care of this stuff. remove these gloves. I'm gonna wash my hands. Okay, and then we're going to get our kit ready to go. Now your bed needs to be at waist length so you don't drop your hands below, and your table also needs to be at waist length so that you don't drop your hands below, okay? Open my kit. Now your outer bag you're going to use as your garbage can. You don't have to play around with where you want to place this, but I find the best place to put this is right here, because once you clean him, you can just come straight across and you don't have to worry about crossing over your sterile field. This I'll save for documentation. Now if you've got two people, that is the reason for the flashlight. They can hold that for you, especially on women, it's easier to see. All right, now I'm gonna open my box, and you wanna kind of position this to where you're gonna keep it so that once they flop over the sides, that is already contaminated. So you can't move things around and then move your box, and because you're going to contaminate it that way. So I like to put mine at an angle, and so it's going to end up square. Now since I'm on this side of the bed, I'm going to go ahead and put this rail down. But if I move away from this side of the bed, I've got to put it back up. So, okay, you have to grab the outer lap first and pull that away from you. And that way you make sure that you're not crossing over the inside of the contents. And then you go side to side. You've got your 1-inch border. This one's being stubborn. Okay. All right, so now this is contaminated, and anything that flops over there is contaminated. So your first glove, I like to grab through the front because you're not going to be putting anything in the front here. But if you're one that likes to grab from the side, I'm just going to demonstrate that if you were to grab from this side and then you moved your box and put this over here on top of that where you reached over and put it back on there, you contaminated the inside of that box. So make sure the bottom of the box goes where you reached over. All right? All right. So I've got my 1-inch border here. This is my bottom drape. I have a shiny side and a dull side on this bottom drape, and you want the shiny side to go down. Now see how I'm holding this? When you kind of do it like you're doing with a bull in a rodeo or whatever, this way you make sure that you're not crossing over. So if you do it this way, see what you're doing? Whereas I did it this way, and that way you're not crossing over. Now if that happens and you check off, just leave it alone. That was just really to make sure that nothing, it kind of keeps the bed dry, basically. It is sterile, but, okay. And then I'm gonna grab my gloves. I'm going to move this table so that I'm not moving around too far away from that bed. Keep that patient close to me, but still I can still see my sterile field. All right, you've got your 2 outer flaps here that you can grab. Open those up. Okay, now for your gloves, you want to make sure that whichever one you grab first, you move over to that side so that you don't risk crossing over your first glove. So I'm going to grab my right glove first. So I'm going to step over here to the side, not too far away from my patient. You grab the outer cuff of that first glove. make sure you keep your hands up when you're putting these on. Okay? Your second glove you grab on the inside of that cuff. Okay, now once you grab that and you start to insert the rest of your hand, bring this thumb out, because a lot of times people have a tendency to touch when they're inserting the rest of their hand. So bring that thumb out and put that second glove on. Okay? I'm going to put this back to where I can reach it. Alright, this should be good. Alright, now I'm sterile, so I can grab this fenestrated drape anywhere. Okay, and again, see how I'm holding it this way, so that once I put it on the patient, I bring my hands up and around this way, so I'm not crossing over the top of that. Alright, now I'm going to prep my box. Okay, now keep in mind that if your box ends up in a different angle to where you cannot reach things, pick it up. Back up a little bit, turn it around, you're all sterile, and put it to where it's going to work for you, and put it back down. Just make sure it's within that 1 inch border. Okay, so first, and make sure you do not cross beyond your gloves. First thing I'm going to do is grab my iodine to put on my cotton balls, rip that open, put that there. Make sure you transfer it to this left hand to put it into the garbage or whatever side you're on the bed, because you cannot go like this and you cannot do this. That is a contamination. So we're going to put that right there. And then I've got my lubrication. I'm going to squirt that in there and throw that out. Now I'm going to transfer the top of my box over here. Okay, all right, and again, this isn't exactly where I want it to be to where I can reach things. So I'm going to pick it up, turn it around, and put it down. Okay, now there's a cover on the inside of, or on the catheter, so you want to get that off. Try to curl this up in your fingers so that it doesn't flop out when you get that off of there. And then I'm going to take that catheter, I'm going to dip it into my lube, and you're going to gently place that back into the box again without ever crossing over. I'm going to grab my fluid to fill my balloon up with. I'm going to attach that. And then I'm ready to put the top part of my box back up there. Kind of push this out of my way and transfer the box over here. Alright, so now, once I grab a hold or separate the labia, whichever one you're doing, do not let go until you are done with your procedure. So I'm going to grab and put it at a perpendicular angle. I'm going to take cotton ball number 1, and you're going to do the same thing as when you cleaned. Start at the tip, go in a spiral fashion, come over here and throw it out. Start at the tip, go in a spiral fashion, throw it out, and use at least 3 of the cotton balls. You can use more if you really need to. Okay, at that point I'm done. And then you can place this down here, or you can place it on the table if it's close to you, but make sure you don't turn your back onto the sterile field. All right, Mr. Thomas, we're getting ready to insert the catheter. Okay, if I could get somebody to spray for me. Okay, all right. All right, now when you insert, you want to make sure that the catheter doesn't touch the tip of the penis. And then you want to make sure that your fingertips don't touch the tip of the penis either, because that will contaminate the catheter. Okay? So we're going to go in, and then you start to walk this in, but you want to tell them to bear down ahead of time. That just makes it easier for the insertion, because that way they're not all tense. So I would have asked him to go ahead and bear down. And then you walk it in. You don't want to let go of the catheter, because if they sneeze or cough, that catheter is going to come right back out at you. For a male, you're going to insert it all the way to the bifurcation. For a female, you're going to go until you get urine, and then you would go 2 to 3 inches more. All right, so now we're all the way to the bifurcation. At this point, you're going to grab an inch away, and you can insert your balloon. Now make sure that you assess for pain while you're inserting this fluid to blow out that balloon, because if they're experiencing pain while you're doing this, it's probably not in the right place. So we're going to go ahead and insert that. Okay, now don't let go of the piston, because all that fluid's going to come right back out at you. So before you let go, I like to pull and make sure that it's actually in place. Then you can let go and disconnect your syringe. Okay? And then you can throw that. At this point, the sterile part of it is basically done. So here I would take care of my garbage, clean him up a little bit. Here you would rip this off, clean him up, put your foreskin back. Okay, and then I'm going to go ahead and take these gloves off. I'm going to wash my hands. I'm going to put clean gloves on. And the reason that you do this, changing your gloves in between, is because oftentimes with your sterile gloves you get the lubricant on there, or you might get some of the iodine on there, and you don't want getting that all over the bag. So when you go to transfer it. Okay, so I'm going to go ahead and grab this bag. Now, depending on your facility, you can actually kink this off before you transfer it down, because they feel that when you initially lift it off of the bed that urine can back up. So we're just going to pinch it off initially before we lower it down. And we're going to put them in this stat lock first. Now for your checkoff, we'll actually have this in place for you, but make sure you do practice a couple times so that you're aware of how to put these on. Got that in place. You want to put this on a non-movable part of the bed and make sure that there's no dependent loops. Okay, no dependent loops. Okay, so we've got that. And then I would take care of all the rest of this stuff. Make sure that Mr. Thomas is comfortable. We're going to put his call light is in place. I'm going to put the bed back down. I'm going to put this one up just for a second while I'll do that first. Now take these gloves off. Alright, now if the bed's down, I can put these down, and of course that's going to depend on your facility as well as to whether if they want them up or down. Put these back down. I'm going to take these gloves off. I'm going to wash my hands. And then I'm going to go ahead and document the date, the time, the procedure, the catheter size, the balloon size, color, clarity, and amount of the urine, and how well the patient tolerated it. And I think that concludes our insertion of a Foley.